Imagine a world without research. What would nurses do, and where would we be today?
But first, can you answer what is research? Research is a way of answering the question why, understanding the issues, and applying the scientific method to gain knowledge. But then why is research important in nursing? Research gives us the knowledge to support nursing practice, it allows for critical thinking and decision making, and it outlines the guidelines us nurses abide by. Research then lends to evidence-based practices, which allow for optimal quality nursing care to improve patient outcomes. It also allows for critical thinking to guide clinical decisions. Therefore, we can say that research has allowed for a standardized nursing practice and advances in healthcare that provide for a high quality of care and safety in nursing care environment.
Research has provided the evidence-based practice that has led to standardized care. Standards of care are legal expectations for nursing practice. Professional nursing organizations develop these standards of care. The College of Nurses of Ontario outlines standards of care as competencies that each nurse must adhere to. It is also required that employing institutions, such as hospitals and long-term care homes, set out policies and procedures to standardize care. These policies and procedures derive from experiences in previous nursing practice, and they are adapted accordingly through research. Also, the RNAO has developed nearly 50 best practice guidelines for client care. These guidelines provide standardization of nursing care throughout Ontario. Without the standards of care and policies and procedures we have in place today, clients and nurses would be at greater risk of harm or legal consequences, as these policies and procedures and standards of care provide a safety net for both the nurses and clients. We shape our standards of care and policies and procedures based on evidence-based practice that is attained through research.
Research is also responsible for keeping nursing care relevant and current. The more healthcare advances we attain, the greater the knowledge in evolving health concerns and innovative treatments. Without research, a patient's safety can be compromised. Imagine if Lister hadn't explored the idea of infection and proper aseptic technique. Hand washing would not be a common practice, and infection would be a serious health concern. Also, through research, diagnostic technology has evolved. Think about vital signs, one of the nurse's key assessments. Without the proper equipment, nurses wouldn't be able to efficiently and accurately record the results needed to support a patient's health. In the end, research is what supports the knowledge to our nursing practice. Research gives nurses the education needed for their practical guidance, policies and procedures from which to abide their practice, and current advances in healthcare that enhance patient quality of care. It is through research that a patient's health and safety can be ensured. So, can you piece it together?